Hello. So today is Thursday, April 30th. Last day of April. Um there's a lot been going on this week. A lot. And I just haven't vlogged it because it's been a lot. So Charlie kind of got hurt. Friday night, we went over to a friend's house, and he went outside to play on the deck with his friend while I was inside, talking to my friend. And there was a hole in the deck, and they knew about it, but they had it covered, but something blew it off or something. But they did tell Charlie, hey, watch out, there's a hole there. And he knew about it, but he forgot, and he was walking backwards, and he fell down in the hole. And oh my gosh, my battery's dying really. Well, I'll go until it dies, and then I'll get the other battery. Anyway, so he fell in the hole. So I'm inside. The little sister comes in. It's like, hey, Charlie fell in a hole. I was like, is he okay? I was thinking maybe just like a little, maybe some scratches or whatever. And she's like, yeah, he's okay, but he needs you. And I was like, okay. So I went out there, and hold on, let me go change the battery because it's just bothering me by flashing at me. Okay, there, got a new battery. Sorry also if I look, I haven't even had a shower in a couple of days. Well, I don't know. Anyway. So Charlie fell through this hole. I go out there. I can see him. Like, they have an upper deck that I walked out on and then a lower deck. And that's where he was. And I go out there. He's kind of sitting. His leg is in the hole. And he's like sitting on the outside of it. And so I go down there. I could see some blood on his leg. So I go down there. I hoist him up out of the hole. He's like crying, of course. We get him up the stairs. And back into the kitchen. And my friend's like, here, let me get some, disinfectant and, Band-Aids and stuff. So she hands me her baby doll, and she just goes and grabs everything, cleans him up. So at this point, we're just thinking, okay, he scraped himself. I mean, it was a cut and everything, and kids do stuff, right? So we bandaged it up. He goes and sits in the living room, plays like Mario Kart with his friend for like an hour and a half while we continue talking. So we get ready to go, and he goes to stand up, and he can not really put any weight on it. And I mean, the cut was like on the inside of his knee, basically. So my friend's husband had to kind of help him down the stairs. They live in like a split level house, so he had to go down like 6 stairs. That took a little bit, and then we got him out to the car. He was in some pain on the way home. Called Eddie on the way home and said, hey, when we get there, I need you to come out and carry Charlie into the house. And I explained kind of what happened. So he's like, okay. So we get home. It's like 11 o'clock. He comes out. He carries Charlie into the house. And we look at the wound and everything again. And it's swollen, of course. And so we're like, okay. So we give him some chewable ibuprofen to take the swelling down and the pain. We clean up the wound again and bandage it. And then he falls asleep on the couch. And that was just easier for him. Next day, Saturday, we inspect it and everything. And swelling has gone down. But he can't put any weight on it. So we're like, okay. Luckily, Eddie had a pair of crutches from when he hurt his leg last year. So Charlie got a crash course in how to use crutches because he had to go to the bathroom. And at first he couldn't get the hang of it. But then when he really had to go to the bathroom, all of a sudden it's like, oh, this is how you do it. And he went off to the bathroom. So we debated on going to urgent care, but it's like, well, let's see, because the swelling's going down and it just looked like it was just a bad cut, So we had him resting and everything, and the family came over later on that day. We grilled burgers, and Charlie seemed to be doing way better. He got up a couple more times on the crutches to move around. He wasn't really, we gave him some chewables. We're like, okay. And at this point, I'll show you guys a picture of kind of what it looked like and why we just didn't think it was that big of a concern. We were concerned, but it was like, I think it's just, we gotta rest and see how it goes. And we did discover he had, the cut was more of like a puncture, because when Eddie was like cleaning it, I think he accidentally pulled off the scab that was starting to form over it, and the way it bled made it seem more like a puncture hole, not a cut. So I was concerned about that because I mean, he fell through a wood deck. So I thought, oh, is there pieces of wood in there? Could it, I was concerned about infection for sure. Anyway, let me show you. This is probably the best picture. So that's like the inside of his knee. That's the puncture, of course, and then there's bruising and swelling and stuff. So I think that was to show how much swelling there was and everything. So, and that's after we had him bandaged up, so that's where it is. He's playing his game. So Saturday went fine. Everything was good. He slept in our bed that night, because, well, he has been, because we still don't have a mattress for his bed, and that's what we were going to do that weekend. But obviously he couldn't walk around. So, slept in our bed. Sunday morning, he gets up. He's in pain. The swelling has not gone down anymore. I mean, it was still down from the initial swelling, but it wasn't down anymore. He couldn't hardly get up. He was basically in tears from the pain, so we're like, urgent care. So we get him out to the car. Eddie had to kind of pick him up and carry him down the steps, which hurt him a little bit, but there was no other way. It was like, we got to get you there. Got him in the car, got him to urgent care, checked in. They wheeled him back. They took x-rays. And so we're sitting in there thinking, okay, they're probably going to tell us, he just hurt his knee. You're doing what you can do. Ice it, pain medication, the swelling will go down. That's what I was thinking, honestly. I was like, it'll be fine. She comes back in and she goes, okay, so she goes, I'm concerned about the swelling and everything. She's like, I'm concerned there's still some, based on the x-rays, it looks like there might be still some foreign debris in the wound, which not good, and also a possible patella fracture. And I'm like, okay. So they said, we're going to send you guys to the hospital and everything. So we're like, okay. So we go over to the hospital, to the ER, get checked into the ER, wait there for about 3 hours, I think. None of us had eaten either. Like, Charlie had a popsicle that morning and some juice, and I had my double shot, and Eddie had cheese. So at this point, it was like, we were in the ER from about, I don't know, 1:30 to 4, something like that. So we're hungry, They finally call us back. They get him in a room and get him on a bed and everything. And then they're like, we're going to have to put an IV in you because we need to take some blood samples. And he was scared about that. He's never had an IV before, so he wasn't as scared. He didn't know what to expect. So the part that hurt him, though, was the tourniquet that they have to wrap around your arm because it was tight and it was hurting him. And then when they put the IV in, yeah, that hurt him. He was like, ow! And I'm like, I'm so sorry. It sucks seeing him in pain. So they took some blood. Then the doctor came in to look at the wound. And, okay, so up until this point, we had been checking that wound like crazy for any signs of infection. Like, it actually looked pretty clean. Like, on that picture I showed, it was just like, there was no redness, no weird dischargey stuff or anything. So we're like, okay, but as soon as the doctor was like, I'm concerned about this redness here. And we're like, what? And we both got up to look, and sure enough, there were some patches of red around the wound now. And I'm like, oh my God. So we're like, okay, infection. So he's like, okay, we'll get you some antibiotics. And he's like, and we're going to take a CAT scan of your knee. We're like, okay. So they wheel him to the CAT scan room. And then he gets in there. They take the pictures, comes back to the room. And, okay, this is where it's just like, this story, it just keeps escalating. Like I said, we thought we were going to get discharged from urgent care and get to go back home. But it just kept escalating. Every time the doctor came in, it was something new. I was like, stop coming in. So he comes back in. He said, okay. He goes, I'm a little stumped. Based on the CAT scan, and he showed us the pictures, it looked like something went in, punctured his bone, like kind of at the low part of his femur, and ripped out a tiny piece of bone. Like, you could see the tiny piece of bone and the slot in his in the knee or femur or wherever that it was supposed to go into. I was like, what? So he had a piece of bone in his leg, and also the foreign debris. So I'm like, oh man, And see, at this point, we also thought, before we knew this, we thought that they would just have to clean out the knee, like maybe numb him up and clean it out for the foreign debris. But now there's a piece of bone. So the doctor's like, I've been here a long time. I've not seen this. He's like, I'm not even sure what to call this. It's not technically an open fracture wound, and and everything. So he leaves for a little bit, comes back, says we may be booking an OR. I'm like, what? He comes back 5 minutes later. We're booking an OR suite. He's getting surgery tonight. I'm like, oh my God. Like, at this point, my head is about to bust because I'm just like, how did it get to this? So they take him to the pre-op room, like, and everything, and they come in. Charlie's getting freaked at this point. He's never had surgery. He's crying, afraid, and we're telling him it's low risk surgery, you know. But so the anesthesiologist comes in. He explains to Charlie, he puts that he's gonna put some happy juice in his line that's gonna relax him and everything. And then the surgeon came over, talked to us, went over everything and consent, and he said the only risk of the surgery is not doing it because it's gonna get infected really bad. We're like, yeah, we want it done. So of course I'm getting a little freaked out at this point because surgery is surgery. I mean, even minor surgeries are a little scary, but I was trying to calm Charlie down, so I didn't say anything. I said everything's gonna be fine, but inside I was freaking out. Okay. So they wheel him back. They put the happy juice in him, and it hit hard. He goes, how long is it gonna take? And the anesthesiologist like, you tell us how long it's gonna take. And the next time Charlie talked, he was just like, I don't know. He started slowing the words and everything. It was pretty funny. So they wheeled him back, and we told him we loved him and everything. And then we went to wait in the waiting room. Now, at this same time, I have other life drama going on. My family had messaged and said my grandma was not doing good. And basically, the doctors gave her only a couple days because she was to that point. And, you know, I've known this was coming for a long time, but the thing is the timing. I mean, it's just like I'm dealing with Charlie. If I could have, I would have flown right down there so I could see her, but I couldn't. So I'm dealing with that while waiting for Charlie. Oh, hold on. Let me show you, before I continue the story, let me show you a few more pictures of as the day progressed. Okay, so this was as we were going into urgent care, and he was on the crutches. This was in urgent care. And he enjoyed the wheelchair. He's like, I've never been in a wheelchair before. And then that was once we got into the ER. He was checked in. That's once they got the IV in him. See how happy he is. Okay, and that picture right there is actually post-op. Okay, so the surgery only took about 45 minutes, something like that. Surgeon came in, said everything went great. They were able to get the piece of bone out, and they washed and debrided it, I think. And he'd have a scar about yay big. He's got stitches. The one thing they were just concerned about is because of where the puncture went in. One, it barely missed his growth plate. Two, it kind of went into the joint, and they were concerned about bacteria and infection because it could still breed, I guess, you know. It's just a high risk injury or whatever. So he was definitely going on antibiotics, but it's something we had to keep in the close. And he took some blood cultures to send to the lab to make sure there's no bacteria. A little while later, they say, hey, he's waking up. You can go see him. So we go back there, and to see him laying in the bed just out. I mean, he was asleep, and just hearing the monitors and everything. That was... So, we're on each side of the bed, and we're holding his hand and everything, waiting for him to wake up, and then he does, and he's like, what happened? And I'm like, you had your knee surgery, and he's like, but that was like 5 minutes ago they took me, and I was like, no, it's been over an hour at this point. He's like, no, and then they gave him some water, and he's like, this is the best tasting water ever. So, they gave him some water and a popsicle, and again, he hadn't even eaten, which actually worked out for the surgery. But they'd only had popsicles all day. We're in the post-op room for about almost an hour. We were waiting on transport up to the room, and they finally came. Wheeled him up to a room in the peds area. At that point, he started waking up a little bit more. And at this point, it's like 1:30 in the morning, right? Eddie went and got him a little food. He ate like a few french fries and something. I forgot what. But I just wanted something on his stomach. Eddie then went to get, once he got settled in the room, Eddie left to come back home to get my phone had died. I couldn't even let anybody know. I had to quickly text my dad and say, hey, I have to talk to you later. And my phone was at 1%. I was like, Charlie's in the hospital. I will fill you in later. And so Eddie came back home to get chargers and a few other things. And so we slept in the hospital, barely. I slept on the little couch they have and everything. And of course, you get woken up by the nurses coming in and doing vitals and everything. So Monday, you know, he was doing good. He was coming out of it. And we got people just constantly stopping in. The surgeon, the nurses, PT came in, physical therapy. They got him out of bed, had him get on crutches, practice going up and down a couple steps, because we have steps here at our house. So I think I have pictures of that too. Okay, so again, that was right after post-op. See, he's got his little popsicle there. He was so out of it. That was when he got some food. That was the next morning. He got a good old breakfast. He was hungry. Okay, so that's what he had on his knee after the surgery. It's this brace, and then he had like a drain tube and everything. So, and then this is him doing physical therapy, going up and down the stairs, practicing that. Oh, and then on Monday, so there was severe weather that we knew was coming in, and 3 times there were tornado warnings, and we had to be put out in the hallway. I mean, talk about my anxiety level. Tornadoes already freaked me out, but with worrying about Charlie and then that and my grandma, I kept getting updates about her. It was just, wow. It was a lot. So then he'd been using the bathroom, or he finally went to the bathroom, which was good and everything. So we didn't know. We thought we'd be discharged that evening because the surgeon said you'll probably be leaving maybe around 7. But the thing is, they were waiting on those blood cultures, and they hadn't heard anything yet or whatever. So we ended up having to stay another night. So Eddie had to go to work on Tuesday. So he went home and slept, because I'm like, you need good sleep, go home and sleep. I'll stay here with Charlie. So he went home and slept. I took off Monday and Tuesday of work, of course. And then Tuesday, just kind of the same thing. Like, his pediatrician stopped in, which was surprising. Other doctors, the infectious disease doctors stopped in and talked to us, because that's when she told us that, you know, they were just waiting to see, because it was such a high risk part to get an infection and stuff. So and then Grandma and Grandpa came by, Uncle Jack came by. Well, actually, Uncle Jack came by when the tornado stuff was happening. They showed up, and then finally, like, once Eddie got off work that day, and his parents showed up at like the same time, and I was hungry because I'd only munched on some chips. So he's like, let's go down to the cafeteria, get some food, just you and me, because we barely had the time to be together. So and Grandma and Grandpa stayed with Charlie. As soon as we go down there, he gets a call from his dad. It said they came in and said he's being discharged, and we're like, oh my god. So I'm like, you know what, I'll eat later. I don't want to get anything here. I'll eat at home. So we come back up, and they basically discharge us. Oh, I forgot one of the worst parts. Before all this happened, so the surgeon came in, and he had to take the drain tube out of Charlie's knee, and he basically just quickly pulled it out because there's no other way to do it. Charlie said that was the worst pain he felt in his life. He said he felt like his knee broke. Because he asked the doctor, is it going to hurt? And the doctor's like, eh. So anyway, I'm trying not to make this a long story, but it's just a lot. So thanks for sticking around and listening. Anyway, so we got the discharge and everything, and got his medication. He's got to take antibiotics for about 14 days. And got doctor's notes and all that. And then, so we go downstairs, we get discharged. Get him in the car, go home. This is where it gets crazy. It's not even over yet. So, we get home. It's slightly chilly outside just because of all the weather and stuff. And he's cold. He had his hoodie on, but he'd been wearing shorts this whole time. We get him out of the car. His leg is in pain. We hadn't really given him any pain medication since the hospital, so it was starting to come back, the pain. And he was tired. So he tries to go up the front steps, but they're taller than the ones that he practiced on at the hospital. So he's crying because he's like, I can't do it. So I said, what if we get a chair, put him in the chair, and then hoist him up the steps? So we tried that, but Eddie didn't trust the chair because these chairs are old and he didn't want it to like break. So then Eddie goes to look at the back steps, and even though there's more of them, they are about the same height as the ones he practiced on at the hospital. So of course Charlie's crying. He's like, I can't make it back there. I was like, I'll follow you behind you in the chair, and you sit down and rest whenever you need it. So that's basically what we did. It took about 10 minutes to get to the back steps. And then once we get back there, he starts to try to go up the steps, but he's just tired. He's worn out. He's in pain. And he's like, I can't. So finally what we did, and I had to show a picture of this too, is he went up the stairs backwards with Eddie hoisting him one step at a time and Grandpa holding onto his brace so that he could keep his leg level because it can't bend or anything. And this is the picture of that. So that's it. So Grandpa was holding his leg and Eddie was hoisting him up backwards. We finally get him in the house. Get him on the couch. Uncle Jack had to happen to stop by. Brought him a gift. A Minecraft chessboard, which was pretty cool because Charlie loves chess. Get him in the house. Get him situated. He gets a popsicle. Now we had noticed that he kept saying that he was cold, which was odd. And then Eddie felt his head, felt warm. Now they said if he has a fever of 101 or more, bring him back because it could be related to the knee. It could be infection, whatever. So Grandma and Grandpa left. Uncle Jack stayed. And then we took his temperature, 101.1. Eddie's not happy. He calls them to follow up and ask if we should come back. And he's reading over the paperwork. And they're like, yeah, you should probably bring him back again. At this point, Charlie loses it. He's tired. He just wanted to stay home. He knows that they're going to have to put an IV back into his arm. I mean, I've never seen him so angry. And my heart was breaking for him because there's nothing I could do for him. And he had to go back. And I've never seen him. He's just like, I hate this. I hate this. And I was like, I know. I know. So, we get him back out there. Get him down the steps again. This time with Uncle Jack's help. Get him in the car. Go back to the ER. Luckily, there's no wait time this time, really. Go back. And get him checked in. I explained that we had just got discharged. Which we talked to the financial lady. Because she's like... they shouldn't have to bill you twice because you were just here. So she was working on that for, I don't even want to know what the cost of all this is. But we finally get back there and they swab his nose and everything because he also had a cough going on. So but he had a cold, you know, like a few weeks ago and we thought it was just a lingering cough. Well, it turns out this whole thing was just, he's got like rhinovirus or whatever, just a bad cold again. So the fever was part of it, cough was part of it. So I had nothing related to the knee, thank goodness. So they basically gave him some Tylenol, started his first thing of antibiotics. They loosened his ace bandage because we were concerned that his leg was so cold. But yeah, it was pretty tight. So yeah, and then they just said, you know, just keep on the lookout for any discharge, any swelling, any temperature changes, you know, and everything. So we're like, okay. So we're at the ER till about 1:30 in the morning. And I had to work the next day. So we get back home, it's like 2 something. This time he actually made it in the house pretty quick because he was tired, he was motivated. So basically we did the same thing except now we went up the front stairs and he was able to go backwards up the stairs a few. And then I had to take a shower because I barely even got a shower at the hospital. So took a shower, got into bed almost 3 o'clock. I had to get up at 6 o'clock, went to work. Of course, I explained it all to my boss, and then I took off today, Thursday, because Eddie had to go to work. And then tomorrow, Friday, Charlie's going to go over to Grandma and Grandpa's. And we almost wanted him to go back to school, but I just wanted him to just have a fresh start next week. And he was supposed to have MAP testing and like end of year test this week, so. But anyway, oh my God. Oh, and then of course the night that Tuesday night when we'd been discharged and then we had to go back to the ER. Right when we got back to the ER, checked my family text, and my grandma had passed away. So, I had to keep it together because I was there for Charlie. I couldn't just start crying, you know. So that was really hard. And honestly, I couldn't even process it fully until the next day when I was at work because finally it was quiet. Like, it was just been chaotic. And then I was at work and then it kind of hit me. And yes, I cried. Cried at work. Because everything hit me. Just Charlie, seeing how much pain he was in. My grandma being worried. And Eddie's so paranoid about his knee right now. He's so afraid of infection. So he's constantly telling me to check it. He checks it. See if there's any temperature changes or anything. But, I mean, he's been doing good. Everything's fine. He's getting around a little bit better. We're doing a little bending exercises on his knee. But anyway, I'll go in there and show you guys how he is. Yeah, and so, yes, and then my grandma, so I just heard that her funeral is going to be this Monday, so I'm going to fly down all by myself, which I've never done, because obviously Charlie cannot come, and Eddie has to be here, and Charlie's got a follow-up appointment on Tuesday anyway. So yeah, it's been crazy, and I didn't vlog any of it because I wasn't honestly thinking, like, I was at the hospital, I was just, it's been crazy, and I feel so bad for Charlie. But anyway, it'll take some time to recover, but yeah, so he gets to play all the games that he wants. And so this is him and his setup in here. He's been sleeping in the recliner because it's easier for him. He's got his stuffed animals. He got a new one from the hospital. This is his surgery crab. See how big it is? And then I'll show you how his leg is. I'm going to uncover your leg here for a minute. So, yeah, there's the bandage and everything. Got him all bandaged up. And yeah, he's got some stitches in there. But how you feeling right now, buddy? Besides the cough.
Pretty good.
Pretty good, yeah. So, yeah. And that's what's been going on. It's madness, I tell you. And the house is a wreck right now. I haven't had time to do anything. So, actually, I am going to try to go in there, clean up the kitchen a bit. But yeah, like I said, I didn't even think about vlogging or anything while I was at the hospital. Because at one point I did. I almost asked Eddie to grab the camera while he was here getting stuff, but then I forgot again. And I was like, whatever, it's not a big deal, you know, so. But yeah, it's been crazy. So, like I said, he has a follow-up in about a week, or on Tuesday. And I don't know when I'm probably going to fly down to Texas Sunday night, because my grandma's funeral starts at like 10 in the morning on Monday. And then most likely come back Tuesday. I get 3 days of bereavement for my job, so. You okay?
Yeah.
Trying to shift?
Go ahead.
Yeah. And Charlie's getting quite the workout on his good leg.
Whoa.
Oh.
I did this.
Oh, yeah. And then his arm is so sore from.
Because 2 IVs in that same spot.
Yeah.
It's not the IVs that make it sore. It's the amount of freaking adhesive tape that they put on there.
Right.
It's like they have to rip it off, and that made my entire.
Yeah. Oh yeah, and so when he got the IV the second time, when we had to go back, because he was really worried about that. But it was
sad.
It was. I know.
It puts a million green on there.
Yeah. It they did it different. One, I don't think they tied the tourniquet as tight, so that wasn't.
No, they tied it around my claw.
Oh well, they did that the first time, but they just tied it really tight that first time. It was around your shirt. So.
Yeah, they didn't tie it as tight though.
But and then they put some numbing cream on there so that when they put the IV in, it wasn't much, and that helped a ton. So overall, it wasn't too bad. But yeah, but that is all I'm gonna vlog for now because one, my arm is hurting, and I think I've ran almost all the battery out of this again. No, but so we got a little bit of a recovery time ahead of us. He'll probably be on crutches for 2 to 3 weeks, I imagine. He's gonna go back to school. They have an elevator at school, so that's good. And yeah, that is what we're doing now. And more to come in a little bit. I'm going to go try to clean some stuff up and check on his temperature and all that. When life happens, it happens. Okay, here's Mr. Lazy Laserson. No, actually.
You need to go run a mile or something?
Yeah, I do expect you to go run a mile. No, he's doing actually really good on his crutches and stuff. So, we've been up and down the hall a couple times. And yeah, and he's like getting very independent and trying to do stuff himself, and he's been stretching his legs, so yep. And then he's got to get up super early tomorrow to go over to Grandma and Grandpa's. He'll probably just sleep here again. This is where he's been sleeping because it's just the easiest, and then they'll go over to Grandma and Grandpa's, and they got a nice recliner too that he can. Theirs is actually way nicer than ours because it's got a little remote, so because ours is like jarring, you have to like slowly do it. But yeah, Eddie's here. We have a couple friends coming over, Brett and Amy. They want to bring Charlie some dinner, so he's gonna get a nice stuffed crust pizza that he likes. And
Stuford crust.
Yep. So yeah, and Eddie and I got my plane ticket for Texas, so I'm leaving on Sunday. Oh, they're here. Anyway, leaving on Sunday, come back Tuesday. But anyway, more to come. Alright guys, that is all for this vlog. Sorry, it wasn't much of anything. I just, you know, updating you guys on what happened to Charlie. I didn't get a lot of vlog today just because I mean, we're basically sitting around at this moment. Our friends came over, we had pizza, and, you know, told the story all over again. And, yeah, so Charlie decided to sleep in the bed tonight. Gotta get up super early, like 4:30, so we can get him out the door, and Eddie's taking him over. And I gotta actually give him medicine in like 30 minutes, so I gotta wake him up to give him, it's just how it worked out. I gotta give it to him at midnight, 8 o'clock, and 4 p.m. So, anyway, I will be vlogging again tomorrow, because it's the 1st of May, so I'll see you guys then.